What have been the results over the last 15 years among the patients that you treated with standard medical care for cardiovascular issues versus the ones you treated with diet and lifestyle?
I haven't done a head-to-head comparison from a standpoint of saying, okay, these guys got only the standard cardiovascular care, and these guys got the nutritional care plus standard and only nutritional, largely because we offer it to everybody, and so it wouldn't be everybody's their own control. What I can say is that those who comply with our nutritional recommendations more do better, and that's just been our observation. That's evidence based on the studies, that some of the things that we've published. So we do know that individuals who follow the healthy lifestyle have an advantage over individuals who just follow who don't follow the healthy lifestyle, who just follow the cardiovascular therapy. And then one thing I'll put as a footnote: the compliance on the standard cardiovascular care. We say that people follow standard cardiovascular care as though everybody's fully compliant with that. The compliance with these medications is very low, because oftentimes people have side effects. They may not take the diuretics when they're out and about. If they get a headache with the beta blocker, they may not take it every day. The statin, they may take once or twice a week. It's very common for patients to come in and tell me that I'm only taking these medications, once or twice a week, or certainly not as prescribed. And so that so-called cardiovascular care, we're not sure what that is either, because there's poor compliance there, and frequently it's because of side effects of those therapies.
Does a whole food, plant-based diet prevent against getting all heart attacks and strokes?
So great question. Now, I'm going to say I don't know the answer to that question in a pure sense, and here's why. When you say whole food plant-based, and I had lots of patients come in and say whole food plant-based, and that's why our program uses what I call a defined plant-based diet. We use a food classification system, et cetera. And the reason is this: and even if you throw in low fat, let's say low fat, whole food plant-based diet, does it prevent heart attacks? We've had people come in and say, like, I've been vegan for 10, 15 years. I've been whole food plant-based 10, 15 years. And I still have high cholesterol, heart attack, or still have coronary disease, et cetera. And when I talk to a lot of these patients, there are other factors that are involved that are non-nutrition factors. So that means, are you getting out and getting fresh air, sunshine, sleeping, that type of thing, which is important. But let's just say that they're all doing those things. But even in a whole food plant-based diet that's low fat, if you're microwaving your food, if you're eating a lot of GMO food, you can still eat processed foods in a whole food plant-based diet in people's mind, because, if I say whole food plant-based low fat, that means a lot of things. That's not a very precise definition. And so, people then translate to be vegan. And yes, they'll eat a lot of greens and a lot of natural stuff, but then they may eat a lot of processed rice, a lot of microwave stuff, a lot of instant oatmeal, and so on and so forth. Because I see these patients coming in, they say, I'm eating a whole food plant-based low fat diet, and I'm still having these problems. And then I get into the nuts and bolts. How are you preparing your food, and where are you getting your food from, and what's in your, and I say, bring me samples of your food. So when you get into the details, it becomes very problematic. What we try to do is we have a food prescription program where it's level 0 to 10, where 10 is the worst food in the world, and 0 is the optimal food for nutritional detoxing. And it's based on not only it being plant-based, which are the lower numbers, but it's also based on the fact that it's minimally processed. So, raw foods have a lower number, which is a higher rating than cooked foods, then dehydrated foods, and so on. So we like to be more precise when we're prescribing food in terms of what people are eating, because there's so much that's done to food nowadays. With the GMO, even the organic stuff, may be shipped and pre-harvested before it's ripened. Some of it may be frozen or gassed, and all these things can have an effect on the nutritional benefit of the foods. And so, there are a lot of factors in there. So I don't want to just sort of blanketly say a whole food plant-based prevent against all heart attacks, because there are a lot of details that are not being sorted out in that statement.
Is there a difference in the age of the people who come to you now with a heart attack compared to when you first started as a physician?
That's a great question. And um, I will say yes from the standpoint of the quantity. The very first heart attack patient I remember taking care of, quote unquote, when I was a medical student. I was a third-year medical student doing my internal medicine rounds at University Medical Branch in Galveston. And the first heart attack patient was a 32-year-old man. So 32 at that time, that's more than 30 years ago, was the first heart attack patient. So symbolically, that set the stage. Now, I've had patients younger than that who've had heart attacks since then. But I would say the reason I said yes is because I'm seeing more people of a younger age coming in with heart disease than I recall seeing when I was in my training.
When does someone need heart surgery, and when can they instead use diet and lifestyle? When is it too late to use diet and lifestyle?
Well, great question. When can someone use heart surgery? I don't like to say instead. So diet and lifestyle should always be the treatment for anybody and everybody who's alive. So that addresses the last question. When is it too late? The only time I haven't had people respond is when I went to the graveyard and sprinkled, green smoothies and juices over the graves, and nobody responds. So we've yet to get response there, still working on those studies. But beyond that, we see that everybody responded. I'll give you an extreme example to make the point. I had a patient who was on life support. Actually, this wasn't the only person, but one of few. This patient was on life support. She had chronic lung disease, heart failure. I had implanted a defibrillator in her, and she had gone to the hospital. She had pneumonia. She was in a long-term acute care hospital, a very small one here in Houston, a number of years ago. And I happened to be the medical director there. That explains why I was able to do some of the things I was able to do. Anyway, she started going down this whole slippery slope of multi-organ dysfunction, cytokine storms, kidneys started failing, and so on. I consulted my colleague and friend who was a nephrologist to start dialysis. The family refused. Just look, we don't want to on dialysis, even though we thought it'd be temporary, but they didn't want that. So I said, I'll tell you what, let's do this. I felt if she didn't have dialysis, she'd die. Let's try. And I just gotten into the realm of treating patients with plant-based nutrition. So what I did with her, she was intubated, so she couldn't swallow food, but she had a peg tube. So what I did with her is that we made green smoothies with using a super green smoothie that had, macroalgae and other super nutrients, all organic, powdered in a powder form. We mixed it with water and we squirted it through her peg tube. And I started taking her off the other tube feeds, and I essentially detoxed her there in the ICU in the long-term acute care hospital. We weaned the medication. She started putting out copious amounts of sputum and mucus through the lungs. And of course, we suctioned that out. But the long story short to that is that she walked out of the hospital. So that was a situation where someone was on life support in sort of an early cytokine storm with multi-organ dysfunction. We detoxed her. All of that stuff started to reverse, and she walked out of the hospital. So it's certainly never too late. And I don't look at it as an either or. Did she need the dialysis? Well, I guess she did because she didn't have it and she did okay without it. But even if she'd have gotten the dialysis, the detox would have been beneficial as well. Yes, she needed the ventilator. Yes, she needed all the other aggressive therapies. So having said that, yes, there are patients who need surgery. When do I recommend surgery? When they have severe disease and let's say they need bypass surgery, they have severe multivessel disease, ejection fraction or the pumping function of the heart is decreased. They have other factors. What I would do with that patient, and we have patients we've done this with, I'll start them on a raw detox and a cleanse prior to surgery. So I'll get them detox and cleanse before going to surgery, and then we get them set up for surgery to bypass those vessels. Would it be possible for that whole condition to reverse on the natural diet? It would be possible. In that situation, they're somewhat in a dire straits. In other words, the surgery could benefit by improving revascularization in addition to what we're doing with the diet. So it's using both interventions. If the person did not want surgery, we certainly could treat them with optimal nutrition, we do this therapy called ECP therapy, external counterpulsation therapy, which improves circulation. It's actually a substitute for bypass. We have patients who refuse bypass, and we've actually do this therapy for them in place of bypass, and it's worked very well in conjunction with our nutritional regimen. So the point is that, yes, there are times that I need surgery. Also, severe valvular disease, severe valvular regurgitation, severe valvular stenosis. These things can be improved with optimal nutrition, but it may take a longer period of time. And also, you're depending on patient compliance, which is the other factor that plays into all of this. So in severe disease where surgery, the data shows that surgical correction has a beneficial impact, I'll then recommend surgery in conjunction with an aggressive lifestyle intervention, with the lifestyle intervention leading the way to prepare them for the surgery and also through surgery as well.